Good afternoon, Professor and classmates. Today, we will be discussing cardiac arrest with passion and insight as our presentation together with Irene Rosales, Adrian Cababat, Daniel Paule, and of course myself, Mikay. What is cardiac arrest? Cardiac arrest is when your heart stops beating effectively. You will suddenly become unconscious or unresponsive. Without any immediate actions to cardiac arrest, it could lead to a sudden death. Cardiac arrest can be caused by a series of factors such as heart disease, trauma, arrhythmia, and other medical conditions. Symptoms may include collapsing, loss of consciousness, abnormal breathing at all, absences of pulse, and cyanosis. Cardiac arrest is very common in people who smokes, has a high blood pressure, heart disease, a family history of heart problems, and people who drinks and do any types of drugs. First aid protocol and procedures. First, assess the situations. Make sure that the area is safe. Check for the person's responsiveness. Breathing 10 seconds. Give 2 breaths using CPR mask if they are not breathing. Initiate CPR if there is no pulse. Number 2, notify crew members, in charge captains, MedLink. While assessing passengers, we would have crew members notify in charge for them to notify the pilots and have the pilots called MedLink. Have a crew members ask if there are any medical professionals that are on board.
Reaction and addressing medical emergency. First, stay calm and evaluate the unconscious passenger for response, breathing, and pulse. Second, notify the cabin crew, in charge, and pilots. While assessing the unconscious passenger, have a fellow crew member notify the in charge and with this. The in charge will call the pilots through the intercom and the pilot will notify MedLink to let us know what steps we will go through as we try our best to resuscitate the passenger. As this is happening behind the scene, we'll have another cabin crew that will be grabbing all the medical equipment we will have on board such as AED, PO2, resuscitation mask, first aid kit, and the emergency medical kit. In charge will also use the intercom to ask if there are any medical professionals on board. The third one, if the passenger is unresponsive, have them lay on the floor or have some help. You lay them on the floor and perform CPR. And the last one, if AED is present, follow the voice prompt on how to attach the pad and how to do CPR.
Medical resources available and how to use them. PO2, portable oxygen bottle. Know how much oxygen to give to the patient and adjust the flow rate. Place mask over patient's nose and mouth. For AED, automated external defibrillator. Open the machine by pressing the green button to turn the machine on. Follow the pictures on the machine as to where to put the adhesive pads. Razor and scissors are included in the kit to remove chest hairs and clothing. The adhesive pads are to be put on above the breast and one below the left hand side of the other breast. Once those steps are done, you will have to follow the prompt that the AED will tell you. Compressions for 2 to 3 minutes, then 2 breaths. This is to be repeated until the machine tells you to stop.
Why is knowing first aid in aviation important? Medical emergency on board. A study at Seattle-Tacoma International Airport reported that 1 of every 39,600 passengers and 1 of every 753 flights experienced an in-flight emergency. And Canadian aviation regulations. According to the Canadian aviation regulations, any airline must offer CPR training for its employees, including flight attendants. In addition, the flight attendant training standards indicates that the program must be validated by an accredited body or by Health Canada and approved by the minister. This ensures that there is always someone capable of providing immediate assistance in case of an emergency, thereby enhancing the overall safety of the flight. And that concludes our presentation. Thank you so much for listening. Have a good day.